Hello everyone, myself Rituparna Borah, Assistant Professor, Institute of Pharmacy, Assam Don Bosco University. Today I am going to discuss introduction of hospital pharmacy. First we start with the definition. What is hospital pharmacy? Hospital pharmacy is the department or domain in the hospital organization which mainly deals with procurement, storage, compounding, dispensing, manufacturing, testing, packaging and distribution of drugs. Hospital pharmacy also concerned with education for pharmacy students, nurses and other staff and researches in pharmaceutical services. It is under the direction of professionally competent and legally qualified pharmacists. Next, we discussed function of hospital pharmacy. What are the function of an hospital pharmacist? Dispensing of drugs and medicine as per the prescription of the medical staff or hospital for outpatient and inpatient. Then purchase of drugs and medicine and other allied stores as per the recommendation of the Pharmacy and Therapeutic Committee. Then providing instruction for proper storage of drugs and medicine. Also maintenance of proper records of the drug purchased. Next, storage and dispensing of narcotic and biological products, narcotic drugs such as various kind of sleeping tablets, biological product, insulin. Okay, then supply and storage of ancillary products and articles required in the hospital, manufacture and distribution of medicaments and products such as transfusion fluids, tablets, capsule, ointments, stock mixer as per the hospital formulary. Next function is your providing therapeutic drug monitoring services by studying effect of various drugs administered to the inpatient. Next function is maintaining relation with the medical staff, nursing staff and the patient, and to maintain the nursing department and central sterile supply unit in the hospital. Also participate in teaching programs of nursing and pharmacy students. Next is your organization, location and layout of an hospital pharmacy. There should be one chief pharmacist. That chief pharmacist have that post-graduation with 3 years of experience in various activities such as dispensing, storage, purchase and inventory control and manufacturing procedure. Next come to the layout and location of hospital pharmacy. The location of hospital pharmacy should be near to the exit door. Then sub-department attached or should be adjacent to the maintained pharmacy, to the main pharmacy. The wards should have easily accessibility. Outpatient department should be well spaced, furnished and provide the educational literacy facility to the patient. Then staff requirements. That staff requirements mainly based upon the bed strength, function and quality of function provided. There should be one chief pharmacist. Then there should be sufficient number of assistant clerks and attenders. In case of manufacturing unit, if in the hospital pharmacy manufacturing unit is present, that time postgraduate pharmacist with 3 years of experience and analytical pharmacist with enough experience is required. Next, pharmacist requirement as per the bed strength of the hospital. In case of 50-bedded hospital, there should be 3 pharmacists. In case of 100-bedded hospital, there should be 5 pharmacists. In case of 200-bedded hospital, there should be 8 pharmacists. In case of 300-bedded hospital, there should be 10 pharmacists. In case of 500-bedded hospital, there should be 15 pharmacists. Then in case of above 500-bedded, there should be 15 to 16 pharmacists. Sorry. Then responsibility of hospital pharmacy. First, we discussed with inpatient pharmacist responsibility. Mainly, inpatient pharmacist deals with central dispensing area, patient care areas, direct patient care areas, and general responsibility. First, we discuss the responsibility of indoor pharmacist in central dispensing area. First responsibility is dispensing of drugs to the inpatient. Then check accuracy of drug prepared, IV preparation and unit dose in case of if followed. Then maintain the proper record and preparation of bills. Keep abreast of the drug information. Then train the new personnel regarding the policy and procedures. Then communicate with all pharmacy staff regarding the new developments in the hospital. Next, coordinate with available staff to best possible use of personnel and resources. Then responsibility of indoor pharmacy in patient care area. Report with nurses involved with administration of the medication and also deals with administration problems and ensure adequate supply is maintained. Then next responsibility is review of drug administration. Then instruction and assistance to the new pharmacist. Then responsibility of indoor pharmacists in direct patient care area. Firstly, they have to identify the drugs brought by the patient. Then secondly, medication history and communicating for the present treatment regimen. Also assistance in selection of drug. Monitor the patient regarding the therapy. Then patient counseling during the discharge. Participate in cardiopulmonary emergency, drugs, sorting and necessary procedure that require pharmacist aid. General responsibility to provide in-service training and education for the pharmacist, pharmacy student, nurses and nursing student, physician and medical student, and to provide information regarding drugs to the physician, nurse and other healthcare professionals. Then responsibility of outdoor pharmacist. Responsibility in central dispensing area. That pharmacists ensure that the proper techniques are used for extemporaneous compound and provides for adequate record keeping and billing in respect of patient medication particulars, record of investigational drug, records of outpatient bills for charge of service and material furnished by the department, also correctly maintaining the prescription files, keep the outdoor pharmacy neat and tidy manner. Then responsibility in patient care area to periodically inspect the medication area on nursing unit and to make sure that they are always adequately supplied with other articles required. Next responsibility is to identify drugs brought into the clinic by the patient and record the patient medication history, monitoring of drugs. Next responsibility is to counsel the patient on the proper use of their medication and prepare the medication for IV administration. Then general responsibility to coordinate overall pharmaceutical needs of the outdoor service area and exercise adequate control over such drugs, to ensure that all drugs are handled properly, such as storage of investigational drugs, to participate in cardiopulmonary emergency, to provide for in-service education and training for the pharmacist, pharmacy items, that is the pharmacy students sent for practical training as a part of diploma and degree courses, and service education to nurses as well as nursing student. Thank you everyone.